You know, it's really funny. They say what happens in Vegas stays in Vegas, but what happens in the bedroom really doesn't stay there. It affects everyone's whole life. And I like to talk about sexual health a little bit throughout the ages, because we're talking about women's health, and sexual issues are going to change as a woman's age changes. You know, it's not just try not to get pregnant, try to get pregnant, try not to get pregnant. I mean, you know, that's the sequence. But for instance, there are a couple of things I'd like to point out. I think one important thing for young women is to make a decision early about whether or not they should have an HPV vaccination. Now, HPV stands for human papillovirus. Mm-hmm. And the reason that's important is because that virus is now associated with cervical cancer and with venereal warts. Now, these are two very uncommon and they're very common and very unpleasant situations. But, you know, it's a sexually transmitted disease.
Okay.
Now, there are vaccinations for women who have not yet begun to become sexually active, and this allows them, by taking this vaccination, not to be at risk, at least about 90% not to be at risk for those two conditions. So,
if I can interrupt there,
yeah.
I have twin girls that are 10 and a half,
Mm-hmm.
so they're going to be coming into puberty. When would you
that's the
start?
question, isn't it?
Yes.
That's a delicate question. You asked something that most mothers ask, and I'm glad that you did, because a lot of people think that if you, in fact, raise this question with your daughters, you're like saying, okay, I know you're a sexual being, you're going to be sexually active, I give you permission to be sexually active.
Kids, yes.
It's all part of how it's presented.
Mm-hmm.
It has to be presented in the context, you know, you're going to get your vaccination for the measles, and you're going to get your vaccination for the mumps, and now there's another virus that they also have. It's called HPV, and we're going to make sure you get your vaccination. My main issue here is to raise the point that this is out there. Mm-hmm. It has to be something you think about. Another thing I'd like to raise in terms of consciousness is the concept of date rape and the concept of rape in general.
Right.
Right now, 1 in 4 women on college campuses is having either date rape or some kind of unwanted sex. 1 in 4.
That's unbelievable.
And so what I would say is that there has to be a discussion. There must be a discussion about the risk. There has to be the awareness. There has to be the understanding not to get yourself in a situation that's awkward. If you are in a situation where people are drinking too much and people want to, you know, start to act a little bolder than they might, or you may act a little bit less wise than you might,
right?
Then it's something to be aware of ahead of time. The other thing is that I would encourage you not to have a drink, even if you're having a soft drink, but I would encourage you not to have drinks, leave them sitting around, and then come back to that drink. Because people put medicines in those drinks that can lead to...
I have heard that. I have friends with college students in...
I have patients who have children from those unfortunate situations, and so
Scary.
I'm telling you, these are not just concepts, these are realities. So if you're going to be at a place like that, finish your drink or put the drink down, go up and get another one.
That's a wonderful tip.
Well, we talked a little bit about, you know, what it's like for younger people, but I want to make sure that we talk about what it's like for women as they hit 30 and beyond and so forth. And the reality is that at age 30 and beyond, there is some decline in libido or in sexual desire. Mm-hmm. It doesn't happen like that. It's more like that. And of course, a lot has to do with who your partner is. Whether it's a man or a woman, it does matter who your partner is as to how enjoyable sex is. But one thing I do want to say is that sexual issues are something that can be talked about with your doctor in the context of a doctor's visit. Mm-hmm. But here's the reality, that in surveys, time after time, that they interview like thousands of people. Mm-hmm. And even though about half of people will actually have some kind of a sexual issue, and for women it increases from about, it almost doubles between the beginning of menopause to the end of menopause, even though that's the case, only a small number of women will actually talk about it with their doctor, because either they think it's embarrassing,
right,
they think the doctor may not be interested, or they think that there's not enough time. So if you have something like that that's on your mind, make sure you talk about it, make sure that you raise the point, and if there isn't time in that particular visit, then schedule a time to come back so that you can address it, because this is an important problem, and it is something that can be treated and dealt with if it's an issue.
You're right. It is difficult for women to bring that up, and that's just we should